Good morning, good morning, good morning. Thank you for joining us today. Still morning, as we stand with White Rose and sharing some news of a new program being brought to the city of York. No one from our elected other officials are here, but we know they stand with us. I want to thank Jim Arvin and Ted Hake, President and Vice President of White Rose, for joining us this morning. I struggle with that A word, so I don't say that often. And I want to give a special shout out and thank you, I believe is in order, to one of our city residents, James Harris, a concerned citizen that brought the possibility of this program that he's going to talk about to myself and our fire chief about at least a year ago. Thank you so much, James. And I told you we were going to keep at it, and we worked at it, and some of us know about it now. And thank you, Chief. We appreciate you staying on it as well, too. This is exciting. We believe it to be a needed program in the city of York, and we're pleased to stand alongside again of White Rose and sharing this announcement with our community, which has a possibility to alleviate some of the financial strains on the general public that they may incur from an uneventful need to utilize emergency transportation or emergency response should the situation arise. Some of us received in the mail this week already information about that. So we want to just elaborate a little bit more on that program this morning. So we thank you for being here with us. Again, I'm very grateful to Jim, the president of White Rose, for being diligent and seeking a preventive solution and providing cost-effective emergency transportation services in our city. So thank you to Jim. Now I'm going to ask Ted, I guess, to share the specifics of the program and give us some more details about what we as city residents can expect. Thank you, Ted.
Thank you, Mayor.
You're welcome.
Good morning. The ambulance subscription program that we're offering for the first time in the city of York ever helps defray the cost of medically necessary emergency health care. Emergency health care can be quite expensive, and it is expensive because of the cost of readiness to respond to emergencies. We have to have multiple resources ready 24 hours a day, whether they're needed or not. And the ambulance subscription program prevents the subscriber from having any out-of-pocket expenses for emergency medical services, so long as the patient's insurance does pay a portion of the bill. So it has to be medically necessary service. But the way it works, for example, if the patient receives a $600 bill for emergency ambulance service and their insurance, whether it be Medicare or private insurance, pays $400, we will write the $100 off. We have seen this program save people as much as $1,200 when they have a high deductible private insurance plan. It's not uncommon for people to have deductibles of $2,000 for an individual and $4,000 for a family. If we transport you in an emergency and you're not a subscriber, you're going to be responsible for a bill that could be as high as $1,200 for paramedic services. But if you are a subscriber and the service was medically necessary, you have no out-of-pocket expense. And oftentimes we are the first people to send the bill for an emergency. Our bill arrives at the insurance company before the hospital, so it is our bill that's being applied to the deductible. In the case of Medicare, traditional Medicare pays 80% of an ambulance bill in an emergency, and you're left with a 20% copay for traditional Medicare, and that copay is around $100 to $120. If you have a Medicare managed care plan, that Medicare copay can be much higher, up to $160. We've even seen $200. The membership is available to households and businesses in the city of York, as well as North York Borough and the greater Pelham-Wrightsville community as well. And just some of the charges, an individual is $40 a year, family is $70 a year, and that covers anyone who legally resides at that residence and receives mail there. A senior citizen couple where both people are over 65 is a reduced price of $55, and a senior citizen living alone that's over 65 is only $35. So easily one emergency situation and can make up for paying an ambulance membership for 5 years, 10 years. So it's an excellent way to guard against the unexpected costs of an emergency. I can take any questions if you have any. Mayor?
I have one question. Do you need a certain percentage of people, of residents to participate in this program for it to pay off?
The federal government, particularly Medicare, requires that our subscription program be what's considered actuarially sound. We have to bring in more money to the program than we write off in charges. Even if we bring in $1 more in a year than we write off in charges, then we are in line with what the federal government looks at in these programs.
And do you know what that number is, how much it costs for the program?
Our program varies. We introduced it a few years ago in Pelham, and this is the first time in the city. So we're crossing our fingers and hoping for a positive response here in the city. That we'll get, hopefully 20% of the city will subscribe, we hope.
As we do, again, resident James Harris brought this club idea to the city of York, and we think it's a good thing for folks to subscribe and be a member of the club. And I think you would attest to that too, James. And so we appreciate our longstanding relationship with White Rose Ambulance and for this program being rolled out for our citizens. So I hope you see it to be a beneficiary, a benefit to us, and we being the beneficiaries for it too. So obviously Tad can stay around and Jim and answer any questions, and you too, James, because again, I think for a citizen to bring this forward, you saw a need for some reason, and we sat down and talked about it, hammered it out, and the chief was on board with it. And White Rose, again, thank you, Jim, for researching it and making it work. And so that's the history of it, and first time in the city of York, and we hope again that it is something everyone can use. Thank you so very much, sir.
Thank you, Mayor, and thanks for your support with this and calling this today. It really is a partnership, and we're all hoping it's successful.
So you can answer any more questions? Okay.